Italy's death toll has now soared past 4,000 after the single largest 24-hour spike in any country since the outbreak began.
Italian Prime Minister Giuseppe Conte said on Saturday that all businesses in the country must close until April 3rd, except those essential to maintaining the country's supply chain. Italy recorded a jump in deaths from the virus of almost 800 on Saturday, taking the toll in the world's hardest hit country to almost 5,000.
I've decided to make you all part of this challenge we're facing. It's the most difficult crisis in our post-war period. During these harsh days, we're witnessing images and news that hurt us deeply, leaving a mark that will stay in our memory forever, even when this crisis is over. Let us hope it's sooner rather than later.
In all major Italian cities, soldiers and police forces are increasing the number of roadblocks to better control the population's movements.
New York Mayor Bill de Blasio has accused President Donald Trump's administration of not doing enough to help the public health sector in dealing with the coronavirus pandemic. De Blasio further called on President Trump to deploy the military and to activate the Defense Act for medical supplies. The United States has reported more than 26,000 confirmed COVID-19 cases, with more than 80 million Americans living under a stay-at-home order.
Truth is, and New Yorkers and all Americans deserve the blunt truth, it's only getting worse. And in fact, April and May are going to be a lot worse. Right now, we are a third of the cases in the country. That's going to get worse. We're about two-thirds or more of the cases in New York State. That's going to get worse. The President of the United States is from New York City, and he will not lift a finger to help his hometown. And I don't get it. I don't get it. Right now, I have asked repeatedly for the military to be mobilized, for the Defense Production Act to be used to its fullest, to get us things like ventilators so people who can live who would die otherwise. I can't be blunt enough. If the president doesn't act, people will die who could have lived otherwise.
What is it that you want?
Citizens, folks who are members of families, right. And we can't get action from the President of the United States. The military has extraordinary medical capacity of its own that's been honed in fighting wars. They can handle any situation. All military personnel who are medically trained should be sent to places where this crisis is deep, like New York, right now.
The Jack Ma and Alibaba foundations have delivered part of their promised assistance of medical supplies to Africa to boost the continent's efforts to combat COVID-19. The foundations are owned by Chinese businessman Jack Ma. The assistance includes test kits, masks and medical protective gear for each of the 54 African countries, 41 of which have reported positive cases of the virus. The SABC's Coletta Wanjohi reported this from Addis Ababa.
More than 5 million face masks, over 1 million test kits, along with protective clothing and face shields. The first portion of the promised aid arrived at the Bole International Airport in Addis Ababa on Sunday morning from China. The packages were labeled with a quote from Nelson Mandela: "When people are determined, they can overcome anything." This shipment from the Jack Ma Foundation is for all the 54 African member states. From here in Addis Ababa, the World Food Programme, which is experienced in logistics, will assist in sharing it equally amongst the member states and shipping it out as soon as possible. The Ethiopian government has offered to transport the supplies to other African states via its national airline, Ethiopian Airlines.
Because we distribute millions of tons of food around the world, we have an apparatus to do that. Significant capacity and knowledge of logistics and supply chain management. In the past, we have brought this kind of capacity to other disease control efforts, in particular the Ebola crisis in West Africa a few years ago. And so building on that experience, we offered our expertise to this, and we are really happy and honored to serve in this way.
The remaining shipment of medical supplies are expected to reach Addis Ababa and be distributed to more African nations over the next few weeks. South Africa, like other countries in Africa, will receive a total of 20,000 test kits, 100,000 medical masks and 1,000 protective suits and face shields.
This contribution by Jack Ma is very important
for the entire continent. And it's a great solidarity shown by a human being. And we're very proud of his contribution. Secondly, we also want to thank the government of Ethiopia, the Prime Minister in particular, for facilitating this contribution to the continent. Lastly, we are appealing to Africa CDC to ensure that this consignment is distributed to all the countries on the continent with incredible speed.
The Africa Centers for Disease Control and Prevention says this donation will greatly bridge the shortage of medical supplies the continent is suffering from as it strives to combat COVID-19.
This is huge. You know, one of the greatest challenges the whole world, not just Africa, is facing is lack of material. The second challenge the world is facing, and Africa, is the ability to scale up diagnostics. And here we are, this partnership, the Prime Minister's initiative and Jack Ma's initiative is going to distribute more than 1 million tests with Africa CDC supporting. I mean, as you know, we have been discussing this. Africa CDC has scaled up to about 75,000 tests to nearly all countries in Africa. But there's no way near to what we require. So this initiative is going to really be a shot on the arm to increase and boost our ability to test people, isolate them, and try to contain this virus.
This donation is part of global efforts that the Jack Ma and Alibaba foundations have promoted to support the areas affected by COVID-19 globally. Colette Wanjohi, SABC News, Addis Ababa, Ethiopia.
As countries around the world grapple with coronavirus, Germany is no exception. German Chancellor Angela Merkel is under self-quarantine after she found out that her doctor tested positive for COVID-19. Last week, the World Health Organization called on world leaders to work together. For more on what is happening in Germany and the embassy, we're now joined via Skype by German Ambassador to South Africa, regular speaker with us now, Ambassador Martin Schäfer. A very good morning to you. The COVID-19 virus has necessitated that we speak regularly. Can you briefly tell us about the decision by Chancellor Angela Merkel to undergo self-isolation?
That we're in this together. That we're in this together, and that is the connection better now?
Much better, thank you.
That everybody is affected by this thing, and our political leaders are not exempt from it. This is a virus that attacks people irrespective of the color of their skin, the money they earn, or the political position they hold. So the Chancellor last night, right after the press conference in which she announced another round of rather drastic measures to bring down the speed of the spread of the virus, was informed about the fact that her doctor that gave her a vaccination against bacteria, against pneumococcus, that is, was tested positive after that happened. So she, of course, decided as a good citizen to go into self-quarantine, and she will be tested along the line and work from home as many of us do. And now, I think we are still in a phase, both in South Africa, in Germany, and in other countries where the spread of the virus isn't contained quickly enough. So that's the reason why the federal government of Germany decided to step up even more the drastic measures to contain the spread of the virus, which includes that in all over Germany, not more than 2 people at once should be together, that there is more shops to be closed, and that the virtual lockdown of the country continues. Now, we took the decision to have those measures in place for the next 2 weeks, and of course the federal government and the governments of our federal states will look very attentively at the number of cases and at the way the population behaves. I believe, we are liberal societies, we are democracies, and we need enlightened and empowered citizens who accept that this is a very exceptional situation. I think we should avoid at all costs the kind of repressive regimes that we find in other parts of the world. But for that, we do need enlightened citizens who are willing to go along the way with us.
Ambassador Schäfer, you're saying that this pandemic has affected countries all over the world. What we're grappling with here in South Africa at the moment is citizens undecided about whether there should be a lockdown or not, awaiting that president's address this evening. Why did Germany move towards drastic measures? Did you find that your initial measures were not sufficient?
I do think that health authorities need to be in the picture. And what we saw in other countries was that the number of confirmed cases through testing was not big enough. Was small. So the health authorities completely underestimated the spread of the virus that was undetected by the health authorities for lack of proper testing, for lack of test kits, for other health system issues or problems maybe. So I think what happened in Germany was that the decision taken was a little bit quicker than in other countries, and I must really commend President Ramaphosa for his bold decisions about 9 days ago, because, when South Africa took the decision that were taken by the president last Sunday, you didn't even have 100 cases. You had, I think, 61, none of which were transmitted in the country. So you are ahead of the curve, and I think we can already see, at least hope to see, in the numbers that are published every day, that the curve is not as exponentially growing as it is in other countries that are so much affected at the moment. So I believe this is not the moment of procrastination. This is certainly not the moment of waiting too long. I think the countries that go bold with their decisions to enforce social distancing will be better off and quicker out of this terrible situation than others.
Some parallels between the countries, your Chancellor self-isolating, our President now having said to have been exposed to somebody, an MP who has potentially also been exposed to other people who have the virus. How is this impacting leaders at this time where so much leadership is required?
I think, of course, it limits the scope of public and communication action, I think, but I think everybody of us has now a little bit of an experience with home office working, with this new life that we had to enter in, and I'm sure that measures are in place through means of modern communication, be it Skype or be it other forms of video or telephone conferencing, that make sure that our political leaders are able to take informed decisions. I don't have any doubt about that in South Africa, and I certainly don't have any doubt about that in Berlin. And I do think it is very important that our leaders give example. They are not exempt from this virus, and if they fall into the frame of the cases that need to be tested, or where quarantine or self-isolation is the measure to be taken, they should be treated. They should do that exactly the way they have done that, and I think that's absolutely exemplary.
So now the World Health Organization has called on countries to work together. What's Germany doing in this regard?
Well, I think, we are right in the middle of a real new world situation, and we have to look at how to contain this virus. But I think we have to slowly but surely also start to think about the world after the containment of the virus, because there will be a life after the coronavirus. And I think we have a choice here to make. South Africa has a choice to make, Germany has a choice to make, and I think all the other countries have a choice to make too. It's a choice about our liberal societies. It's a choice about whether or not we want repressive regimes that enforce health instructions, or we want enlightened and empowered citizens. It's a choice about whether we want a world of solidarity, or we want a world of nationalism. And I can tell you the choice that my country has made is we want a world of solidarity, and that's why I can tell you that in our binational commission, when the Foreign Minister of South Africa, Mrs. Pandor, and the German Foreign Minister met virtually on Friday by video conference, they discussed at length about this issue of solidarity, and the decision was taken that the German government will dedicate another another 38 million rand to South Africa to make sure that South Africa can properly fight the scourge of this virus. And I think the Department of Health has already decided that it wants to use this money to get test kits, to get equipment for hospitals, to make sure that South Africa is, to the best of all possibilities, prepared for the rise of the number of patients in their health facilities. And I think that's a very speaking expression and symbol of the solidarity we should all be in.
Ambassador, just beyond the outbreak, there's conversation that's taking place now saying that the virus is exposing two fundamental flaws in our society: children's nutrition being tied to public schools and healthcare being tied to employment. How do you think this conversation will unfold in the coming days?
Well, first of all, I must say, if I read the international media on Corona and Africa, I do see a lot of prejudgments coming out there and cliches being transposed to the international public opinion. I am not so sure. I have no idea what the impact of this virus in Africa and in South Africa, for that matter, will be. We see in Europe that most of the infected, in fact, almost all of the people that succumb to this terrible virus are people beyond the age of 60. Now, if I look at the demographics of my continent, of Europe, or of my country, Germany, then I see that the average age in Germany is something beyond 47. So I'm considered to be a young man in Germany. Yeah. But I'm certainly not in South Africa, because your average age, and also in the townships, is not much more than 20. So I do believe that there's no reason to assume that in Africa this is necessarily a disaster that is far more terrible than any place else. It might be, but it doesn't need to be. And I think the second point that you have raised, that health insurance is linked to employment, is an issue that not only exists in Africa. You have that in the United States, for example, in other countries in which health is considered to be more of a market or capitalistic kind of approach, and not an issue of solidarity within a society. And I think this virus, this coronavirus, highlights the issues around justice, around fairness, and about a society that is caring with one another. It must not be that it's the poor that suffer from it and the rich can evade it. That would be a situation that a society like mine, or like many others in the world, I think would find hard to accept.
So, Ambassador Schäfer, that German cruise ship in Cape Town last week causing a big talking point, can you tell us how far is the process in trying to resolve this?
I'm glad you asked that question, because it gives me the opportunity to really say this is also an expression of solidarity between South Africa and Germany. We had about 1,250 tourists on board of that cruise ship of the AIDA group. More than thousands of them were German nationals, and we had a situation where there were suspicious cases about corona, which at the end of the day, luckily, turned out to be negative. And we had a humanitarian situation in which those people needed to be evacuated, to be brought home. And I can tell you, we had a number of rather difficult discussions with the South African government, because we had to deal with the whole humanitarian issue around the German and other nationals from Europe mainly, and South Africa had a very legitimate interest in making sure that those people would never be able to spread the virus further on South African territory. And the solution we found is a compromise, is an idea that made sure that there's no risk for any South Africans, and at the same time made sure that those people could disembark from their ship in Cape Town, be brought immediately to the tarmac in Cape Town, and be flown out by charter flights from Frankfurt from Lufthansa. And I can tell you that I am really glad, and I am happy to say that all those passengers have now left South Africa. There was no health issue at all involved, and I can tell you that the cooperation with the Department of Transport, with Minister Balula, with the people of the Department of Health, with the port authorities, with the government of the Western Cape was really, really exemplary, because we were able to put ourselves in the shoes of the other, to show empathy and to understand what interests were at stake, and everybody had an interest to find the right and proper solution, both to the humanitarian needs of those people on board of the cruise ship and the health issues involved for South Africa.
And finally, Ambassador, Germany is one of the countries being mentioned in conversations around a vaccine. As we speak, what is the situation?
We are, I think, very far away from claiming victory yet. I do think that this coronavirus is not that much of a different thing to many other viruses for which we are able to develop vaccines, like for flu, for example. So I am very optimistic, and I'm very confident that human science, that human creativity, that human ingenuity will make sure that we find a vaccine against the virus. Whether that happens in Germany or in South Korea or in Japan or the United States of America shouldn't and mustn't make a difference, because this vaccine should and must be made available to everybody that needs it. And that's another thing where we have to decide between international solidarity, the world of multilateral peaceful cooperation that we know, or the brigades of the My Country First. I think I can assure you, if this vaccine would be developed in Germany, we would make sure that everybody else could benefit from that too. But I believe we do need some more time for that. I think it's very much too early to say now that we have something that easily will contain the spread of the virus. I'm sure, and I think we must tell our people, we must tell public opinion, that this is not the moment to hope for the vaccine. This is the moment to do something for yourself to help your society get over this.
Your Excellency, thank you so much for your time.
Thank you.
Ambassador Martin Schäfer, German ambassador to South Africa.